and we were walking her dog. I'm walking on a retractable leash, and I'm looking at the dog's rear end, and we both noticed that she was kind of limping on the right side. So then I go, when was she spayed? She was spayed around 3 months old. And then I thought, I wonder if early spaying and neutering, in addition to behavioral problems, which could be caused by the early spay and neuter, are the reasons why you see so many dogs that have ACL tears, tendons, and joint problems. Because we do know that early spay and neuter will inhibit joint and bone density, joint health, growth plate health, and bone density. And then on top of that, obviously, there's a weight issue problem in America in regards to dogs. So you add all that up, man, that's just a recipe for dogs having, the dog was only 8 years old, dogs having issues with tendons, joints, you name it. So I'm wondering if there's any correlation. So again, in my observation of 19 years doing this, and observed closely dogs that were spayed and neutered early and how their behavior was maybe linked to that, but also how their overall physical health was linked to that. So we're always looking at a dog's physical health and then how it's linked to, or if it's linked to early spay and neuter. I will say the majority of the dogs that I get are spayed and neutered because the majority of the dogs that I get are coming from rescues and shelters, which most rescues and shelters have a policy that they will spay and neuter before they release the dog to the owners, no matter how old. The dog can be a puppy, and if you're going to adopt this dog out, it has to be spayed or it has to be neutered. So I'm wondering if early spay and neutering is at all linked to all these ACL tears, hip issues, elbow issues, spinal issues, if that's linked to that. Because again, I do know that if you don't spay and neuter a dog versus if you do, let's say you have two dogs in the same litter and you spay and or neuter one dog in the litter and you don't for the other, and they're siblings and they can look similar, they sort of look night and day different. And I know that the people who are really in the know that obviously not all dogs in a litter are going to look the same and be the same size. I get that. However, it is a drastic difference between a dog that is spayed and neutered early versus a dog who is not altered at all. And I mean that in the bone density is most obvious. The dog's head usually gets much bigger. The chest gets much bigger. The arms are more wide. And the dog has muscle maturity. The dogs that do get spayed and neutered early, they usually just look like a big puppy. They don't get to have that muscle maturity. So that are needed to support all of the weight and all of the movement. So I just wanted to hop on here and just poke a little bit. I'm not sure. I'm not a scientist. I'm not a veterinarian, but I have been doing this for long enough, and this did pop into my mind, and I'm thinking, again, just observationally, I do think that there is something that you can tie together in regards to early spay and neutering and behavioral health. But on top of that, are we seeing those same things result in physical health. Here's the other thing. Okay, so on top of the behavioral issues that happen as a result of early spay and neuter, what about now keeping the dog healthy, or keeping the dog calm is a whole nother task into keeping the dog physically healthy. Because a lot of people will say, and this is common knowledge amongst dog owners, that if the dog owner tears one ACL, then it's going to tear the other. Okay, so we've accepted that. Okay, but why? Does that mean that is there a link to, because I know this for sure, that dogs that are hurting and in bad health, if they are reactive dogs in any way, they can't help but to overwork. They don't get an opportunity to rest, because some dogs day after day are going to be reactive at the window, bark, 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 or on a walk, reactive to dogs, bark, 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 reactive to people, what have you. Those dogs the ones that we're talking about as far as the ones that re-injure themselves because they can't help it. So I'm saying all that to say training matters big time in regards to that, because my training is all about teaching people how to get their dogs calm on command. Keeping their dogs calm on command will help lose the need to want to react to every mailman, every dog walking by, every person walking by. So I really want to get that message out there, that if you have a sick dog and he's reactive, you may want to get training before running to the vet or after running to the vet, so that the dog can rest enough to actually fully heal. So, yeah, good conversation to have, I think. And I'd love people's insights. So if you have any, please comment. If you have any experience in regards to your dog's ACL being torn or anything like that, also please comment. But don't forget to like and subscribe. That'll be it for today. We'll see you guys in the next one. Hope you have a great one. Peace.